Mommy Makeover is one of the most requested appointments in my book. And it's when a woman who's had multiple children, or even one child, comes in and is dissatisfied with how their body is. Most women who are in this situation who come and ask me for a mommy makeover feel that their breasts are deflated and sagging, and that their abdomen is also sagging and just not the same as it was before they had their children. They're bothered by the extra skin of their arms, they're bothered by extra skin in their fat of their back, or extra fat above their breasts. They feel that their pubis, or their mons, has deflated and sagged. And there are just many things that potentially bothersome to them. And so women who are bothered by sagginess and deflation of their breasts can have several surgical procedures. Sometimes it's a lift, sometimes it's a lift with an implant, or sometimes it's just an implant, or even it's a reduction. And the combination of those surgical procedures would rejuvenate a breast and certainly make moms quite happier. And then their abdomen, unfortunately, also goes through many changes after having children. The skin is sagging, their abdomen is rotund, and sometimes there's something called diastasis, which is splaying of and stretching of their abdominal wall. And that all could be repaired during an abdominoplasty, and also known as a tummy tuck. We as plastic surgeons like to look at our patients 360 and look at all aspects of them. And so we also talk to them about changing and contouring other parts of their body, because we know that if there's improvement to their breasts and their abdomen, they're going to be bothered by other things, specifically their waist, their outer thighs, their inner thighs, their buttock, and their back. And all of those things can be treated with surgery, with liposuction, and could potentially be done at the same time. Patients often have their breasts and abdomen done at the same time, but when you're removing skin and fat from other parts of the body, that might need to be staged. When my patients come to ask me about surgery for their abdomen, so for an abdominoplasty, I let them know that that's one of the biggest procedures that I do. And so there's a cost factor, but there's also a downtime factor to that. You gotta give me 2 weeks for a tummy tuck, because I think some people take a little bit longer to recover than others. I just let my moms and dads know that they can't be the primary caregiver for their kids for that first 2 weeks, and they really need to kind of have a team approach in their recovery.